Question 1. Investigation of a 4-year-old child reveals a significant but asymptomatic congenital heart defect that is amenable to surgical correction with a high success rate and minimal long-term risk. The parents, citing religious beliefs and a desire to avoid any medical intervention that could potentially cause discomfort or side effects, refuse consent for the recommended surgery. They express a preference for prayer and natural healing. The pediatrician has thoroughly explained the risks of the defect progressing and the benefits of surgery, but the parents remain steadfast in their refusal. What is the most appropriate next step for the pediatrician? Option A. Document the parents' refusal and continue to monitor the child's condition, providing supportive care. Option B. Strongly advocate for immediate surgical intervention, overriding the parents' wishes and proceeding with the surgery based on clinical judgment alone. Option C. Respect the parents' decision without further intervention, as parental autonomy is paramount in medical decision-making for children. Option D. Consult with the hospital's ethics committee and child protective services to discuss the situation and explore legal options for ensuring the child receives necessary medical care. The correct answer is A. Document the parents' refusal and continue to monitor the child's condition, providing supportive care. Explanation. This scenario presents a professional challenge due to the inherent conflict between a parent's expressed wishes and the pediatrician's clinical judgment regarding a child's well-being. The pediatrician must navigate this ethical dilemma by prioritizing the child's best interests while respecting parental autonomy, all within the framework of pediatric practice guidelines and ethical principles. Careful judgment is required to balance these competing values and ensure appropriate medical care. The correct approach involves a structured, empathetic, and evidence-based process. It begins with a thorough assessment of the child's condition, gathering objective data, and considering the parents' concerns. This is followed by clear, non-judgmental communication with the parents, explaining the clinical reasoning, the rationale for the recommended intervention, and the potential risks of inaction. The pediatrician should actively listen to the parents' perspective, address their fears, and explore shared decision-making opportunities. If, after thorough discussion and education, the parents continue to refuse a medically indicated intervention that is crucial for the child's health and safety, the pediatrician must then consider escalating the situation to child protective services or seeking legal intervention to ensure the child receives necessary care. This approach aligns with the ethical principles of beneficence, acting in the child's best interest, non-maleficence, avoiding harm, and respect for autonomy, while acknowledging that parental autonomy is not absolute when a child's welfare is at stake. It also adheres to professional guidelines that mandate advocating for the child's health needs. An incorrect approach would be to immediately dismiss the parents' concerns and unilaterally impose a treatment plan. This fails to acknowledge parental rights and can erode trust, potentially leading to further noncompliance or alienation. Ethically, it violates the principle of respect for persons and can be seen as paternalistic. Another incorrect approach would be to accede to the parents' wishes despite clear evidence of medical necessity for intervention, thereby neglecting the duty of beneficence and potentially causing harm to the child. This would be a failure to uphold professional responsibilities and could have serious medical consequences for the child. Finally, an approach that involves aggressive confrontation or judgment without attempting to understand and address the parents' underlying concerns is also professionally unacceptable, as it hinders effective communication and collaborative care. The professional decision-making process in such situations should involve 1. Comprehensive assessment of the child's medical status and the family situation. 2. Open and empathetic communication with the parents, actively listening to their concerns and providing clear, understandable information. 3. Presenting evidence-based treatment options and explaining the rationale and potential outcomes. 4. Engaging in shared decision-making, seeking consensus where possible. 5. Documenting all discussions, assessments, and decisions thoroughly. 6. If consensus cannot be reached and the child's health is at significant risk, consulting with colleagues, ethics committees, or legal counsel, and if necessary, reporting to Child Protective Services. Question 2. The efficiency study reveals that a 4-year-old child is frequently engaging in imaginative play that sometimes involves taking charge and directing other children, but also exhibits moments of defiance and frustration when their ideas are not immediately implemented. The parents express concern that their child is becoming too bossy and is struggling with impulse control. considering Erickson's stages of psychosocial development, which approach best addresses the pediatrician's assessment and guidance in this situation. Option A. Interpret the child's behaviors as a sign of a lack of parental control and recommend stricter disciplinary measures to curb the child's perceived bossiness and defiance, without further exploration of the developmental context. Option B. Focus the discussion primarily on the family's reported financial challenges, suggesting that these are the root cause of the child's behavioral issues and recommending immediate referral to social services for parental support. Option C. Advise the parents that the child's behaviors are typical for their age and that they should simply let the child grow out of it, as developmental stages are largely predetermined and parental intervention is often unnecessary. Option D. Educate the parents on fostering the child's sense of initiative by encouraging exploration and providing opportunities for leadership within safe boundaries, while also guiding them on setting consistent limits to help the child manage frustration and understand consequences, thereby supporting the resolution of the initiative versus guilt crisis. The correct answer is D. Educate the parents on fostering the child's sense of initiative by encouraging exploration and providing opportunities for leadership within safe boundaries, while also guiding them on setting consistent limits to help the child manage frustration and understand consequences, thereby supporting the resolution of the initiative versus guilt crisis. Explanation. This scenario presents a professional challenge because it requires the pediatrician to assess a child's developmental stage and potential psychosocial conflicts, which are foundational to healthy development, while also considering the practical implications of a family's socioeconomic status. The pediatrician must balance the theoretical understanding of Erickson's stages with the real-world challenges families face, ensuring that interventions are both developmentally appropriate and culturally sensitive. Careful judgment is required to avoid pathologizing normal developmental struggles or making assumptions based on external factors. The correct approach involves recognizing that a child exhibiting behaviors consistent with the initiative versus guilt stage, ages 3-6, is exploring their world, testing boundaries, and developing a sense of purpose. The pediatrician's role is to support the parents in fostering this exploration, while providing guidance on setting appropriate limits. This aligns with the ethical principle of beneficence, ensuring the child's well-being and healthy psychosocial development. Furthermore, it reflects a commitment to evidence-based practice by applying established developmental theories like Erickson's. The pediatrician should encourage parental strategies that validate the child's efforts, offer choices within safe boundaries, and help the child understand the consequences of their actions without instilling excessive guilt. An incorrect approach would be to immediately attribute the child's behaviors to a lack of parental supervision or discipline, solely based on the family's reported financial strain. This approach fails to acknowledge the normative developmental tasks of early childhood and risks stigmatizing the family. It overlooks the possibility that the observed behaviors are typical expressions of a child navigating the initiative versus guilt crisis. Ethically, this is problematic as it could lead to misdiagnosis, unnecessary interventions, and a breakdown of trust between the pediatrician and the family. Another incorrect approach would be to dismiss the observed behaviors as simply typical for their age, without further exploration or offering supportive guidance to the parents. While the behaviors might be age-appropriate, failing to engage with the parents about how to support the child's initiative and manage potential guilt is a missed opportunity for preventative care and parental education. This approach neglects the pediatrician's responsibility to actively promote healthy development and provide anticipatory guidance. A final incorrect approach would be to focus solely on the financial difficulties of the family and suggest that these are the sole cause of the child's behaviors, potentially recommending external social services without a thorough developmental assessment. While socioeconomic factors can influence development, they are not the sole determinant. This approach oversimplifies the complex interplay of factors influencing a child's psychosocial development and may lead to a premature and potentially inaccurate conclusion, failing to address the core developmental task at hand. The professional decision-making process for similar situations should involve a comprehensive assessment that integrates developmental theory with an understanding of the family's context. This includes active listening to parental concerns, observing the child's behavior, and applying knowledge of developmental stages. The pediatrician should then collaboratively develop a plan with the parents that supports the child's psychosocial growth, provides education on age-appropriate behaviors and parental strategies, and addresses any underlying concerns without making assumptions. Question 3. Stakeholder feedback indicates a concern regarding a 3-year-old child presenting with frequent temper tantrums, difficulty separating from the primary caregiver, and a tendency to engage in solitary play with limited interaction with peers. The pediatrician needs to assess the impact of these behaviors on the child's emotional and social development. Which approach best addresses this concern within the regulatory framework for boards certified in Pediatrics, BCP? Option A. Conduct a thorough developmental assessment focusing on the child's attachment patterns, self-regulation abilities, and social interaction skills, while also gathering information about the home environment and caregiver interactions. Option B. Directly address the parent's perceived shortcomings in managing the child's behavior, providing immediate corrective advice. Option C. Document the observed behaviors and advise the parent to seek external behavioral therapy without further in-office assessment of the child's developmental context. Option D. Prioritize a physical examination to rule out any underlying medical conditions that might be contributing to the child's behavioral presentation. The correct answer is A. Conduct a thorough developmental assessment focusing on the child's attachment patterns, self-regulation abilities, and social interaction skills, while also gathering information about the home environment and caregiver interactions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a pediatrician to balance the immediate needs of a child with the broader implications of parental behavior on the child's emotional and social development, specifically attachment and self-regulation. The pediatrician must navigate potential parental defensiveness or misunderstanding of developmental principles while upholding the child's well-being as the paramount concern, all within the ethical and legal boundaries of pediatric practice. Correct approach analysis. The correct approach involves a comprehensive assessment of the child's attachment patterns and self-regulation skills by observing interactions, gathering history from multiple sources if available and appropriate, and considering the developmental stage. This approach is justified by the board certified in Pediatrics BCP ethical guidelines, which mandate prioritizing the child's health and welfare. Furthermore, understanding attachment and self-regulation is fundamental to assessing a child's overall emotional and social development, which directly impacts their long-term health outcomes. This approach aligns with best practices in developmental pediatrics, emphasizing evidence-based assessment and intervention. Incorrect approach is analysis, an approach that focuses solely on the child's physical health without exploring the underlying emotional and social factors contributing to the observed behaviors is insufficient. This fails to meet the BCP standard of holistic child care and neglects the critical impact of attachment and self-regulation on a child's well-being. An approach that immediately labels the parent as the sole cause of the child's difficulties without a thorough assessment is premature and potentially harmful. This overlooks the complex interplay of factors influencing child development and could alienate the family, hindering future collaboration and support. It also risks violating principles of non-maleficence by causing undue distress to the parent. An approach that dismisses the parent's concerns as irrelevant to the child's developmental trajectory is unprofessional and unethical. The BCP framework emphasizes a collaborative relationship with families, and parental input, even if seemingly misaligned with developmental theory, should be explored to understand the family dynamic and identify potential areas for support. Ignoring parental perspectives can lead to missed opportunities for intervention and a breakdown in the therapeutic alliance. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough, non-judgmental assessment of the child's developmental status, including emotional and social domains. This involves active listening to parental concerns, observing child-parent interactions, and gathering relevant history. Based on this comprehensive understanding, the pediatrician can then formulate a plan that addresses the child's needs while providing appropriate guidance and support to the family, always prioritizing the child's best interests within the ethical and legal framework of pediatric practice. Question 4. The review process indicates a pediatrician is managing a young child struggling with a new self-care skill, such as buttoning a coat. The pediatrician observes the child's attempts, notes specific difficulties, and then demonstrates a partial solution, allowing the child to complete the task with minimal further guidance. This approach is then repeated with increasing independence for the child over subsequent attempts. Which of the following best describes the theoretical framework and implementation strategy being utilized by the pediatrician in this scenario? Option A. The pediatrician is employing a behaviorist approach by using positive reinforcement to shape the desired self-care behavior. Option B. The pediatrician is implementing a direct instruction model, providing explicit step-by-step guidance for the self-care task. Option C. The pediatrician is utilizing Piaget's theory of cognitive development by focusing on the child's sensoromotor stage and encouraging independent exploration. Option D. The pediatrician is applying Vygotsky's sociocultural theory by identifying the child's zone of proximal development and employing scaffolding to facilitate learning and skill acquisition. Correct answer is D. The pediatrician is applying Vygotsky's sociocultural theory by identifying the child's zone of proximal development and employing scaffolding to facilitate learning and skill acquisition. Explanation. The review process indicates a potential gap in a pediatrician's application of Vygotsky's sociocultural theory, specifically concerning the zone of proximal development, ZPD, and scaffolding, in managing a complex pediatric case. This scenario is professionally challenging because it requires the pediatrician to not only possess theoretical knowledge, but also to translate that knowledge into practical, ethical, and effective patient care strategies within the established regulatory framework for pediatric practice. The pediatrician must balance the child's immediate needs with the long-term goal of fostering independence and skill development, all while adhering to professional standards and guidelines. The correct approach involves the pediatrician actively engaging with the child and their caregivers to identify the child's current abilities and the next level of skills they can achieve with appropriate support. This means observing the child's interactions, asking targeted questions to both the child and caregivers, and then providing tailored assistance, scaffolding, that bridges the gap between what the child can do independently and what they can do with guidance. This scaffolding should be gradually withdrawn as the child gains proficiency, empowering them to perform tasks independently. This aligns with the ethical imperative to promote patient well-being and autonomy, and the professional responsibility to utilize evidence-based developmental theories to optimize care. Regulatory guidelines for pediatric practice emphasize individualized care plans that foster development and independence, which is precisely what effective ZPD and scaffolding aim to achieve. An incorrect approach would be to simply provide the child with the correct answer or perform the task for them without understanding their current developmental stage or providing opportunities for them to learn. This fails to leverage the ZPD and bypasses the crucial scaffolding process, hindering the child's development and fostering dependency. Ethically, this is a failure to provide optimal care and promote the child's potential. Another incorrect approach would be to expect the child to achieve the next developmental milestone without any support, ignoring their current limitations and the concept of the ZPD. This can lead to frustration for the child and caregivers, and is a failure to apply developmental theory effectively. A third incorrect approach might involve over-scaffolding, where the pediatrician or caregiver consistently provides too much assistance, preventing the child from experiencing the challenge and satisfaction of mastering a skill independently. This also undermines the goal of fostering self-sufficiency and can be seen as a misapplication of the scaffolding principle. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reassessment. Pediatricians should first assess the child's current developmental level and identify specific areas where support is needed. Then, they should design and implement scaffolding strategies that are appropriate for the child's ZPD, ensuring that the support is neither too little nor too much. Finally, they must continuously monitor the child's progress and adjust the scaffolding as needed, gradually reducing support as the child becomes more capable. This iterative process ensures that care is responsive, effective, and aligned with developmental principles and professional standards. Question 5. The control framework reveals that a pediatrician is evaluating a 3-year-old child with a known genetic syndrome associated with a higher risk of neurodevelopmental delays. The child exhibits some behaviors that are not perfectly aligned with typical developmental milestones, but demonstrates remarkable adaptability and problem-solving in novel situations. Which approach best reflects an understanding of dynamic systems theory in this context, considering the regulatory requirements for comprehensive pediatric care? Option A. Strictly adhere to a checklist of age-expected milestones, immediately flagging any deviation as a potential consequence of the genetic syndrome and initiating a standardized intervention protocol. Option B. Interpret all observed behaviors through the lens of the genetic syndrome, seeking to confirm a specific diagnostic label rather than observing the child's dynamic interaction with their environment. Option C. Prioritize standardized, cross-sectional developmental assessments to identify specific deficits, assuming that any observed atypicality is a direct and predictable outcome of the genetic predisposition. Option D. Focus on the child's observed self-organization and emergent skills across various environmental interactions, recognizing that development is a nonlinear process influenced by multiple interacting factors, and use this understanding to inform ongoing assessment and support. The correct answer is D. Focus on the child's observed self-organization and emergent skills across various environmental interactions, recognizing that development is a nonlinear process influenced by multiple interacting factors, and use this understanding to inform ongoing assessment and support. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatrician to interpret complex developmental patterns in a child with a known genetic predisposition for neurodevelopmental disorders. The challenge lies in distinguishing between typical developmental variations, which are often non-linear and emergent, and signs of a more significant deviation that might warrant early intervention. The pediatrician must apply theoretical frameworks like dynamic systems theory to understand how multiple interacting factors, biological, environmental, social, contribute to the child's overall development, recognizing that the system's behavior can be unpredictable and emergent. This requires a nuanced approach that avoids premature labeling or over-intervention while ensuring timely identification of potential concerns. Correct approach analysis. The correct approach involves observing the child's behavior across various contexts and over time, looking for patterns of self-organization and emergent skills. This aligns with dynamic systems theory's emphasis on the interconnectedness of factors and the nonlinear progression of development. Regulatory frameworks for pediatric practice, while not explicitly detailing theoretical models, mandate comprehensive developmental assessments and individualized care plans. This approach is ethically sound as it prioritizes the child's well-being by avoiding unnecessary medicalization of normal developmental variations and ensures that interventions are based on observed, emergent needs rather than assumptions. It respects the inherent complexity of child development and the principle of beneficence by seeking to understand the child's unique trajectory. Incorrect approach is analysis, an approach that focuses solely on a checklist of age-expected milestones, ignoring the child's unique interactional patterns and the context of their development, fails to acknowledge the nonlinear and emergent nature of development as described by dynamic systems theory. This can lead to misinterpretation of a child's progress, potentially causing undue anxiety for parents or delaying necessary support if a deviation is missed. Ethically, this approach may violate the principle of justice by not providing individualized care. Another incorrect approach would be to immediately attribute any deviation from a rigid developmental timeline to the known genetic predisposition, without considering other contributing factors or the possibility of self-correction within the dynamic system. This oversimplifies the complex interplay of influences and can lead to premature diagnosis or unnecessary interventions, potentially causing iatrogenic harm and violating the principle of non-maleficence. A third incorrect approach might involve over-reliance on standardized, cross-sectional assessments that do not capture the dynamic, evolving nature of a child's skills and behaviors. While standardized tests have a role, they can miss emergent abilities or the adaptive strategies a child employs to navigate their environment, which are key concepts in dynamic systems theory. This can lead to an incomplete picture of the child's functioning and potentially inappropriate recommendations. Professional reasoning. Professionals should adopt a framework that integrates theoretical understanding with regulatory requirements. This involves 1. Recognizing the inherent complexity and dynamic nature of child development, as articulated by theories like dynamic systems theory. 2. Conducting comprehensive, longitudinal observations that consider the child's environment and interactions. 3. utilizing a range of assessment tools, both standardized and observational, to capture emergent skills and patterns. 4. Collaborating with parents and other caregivers to understand the child's behavior in different contexts. 5. Applying ethical principles of beneficence, non-maleficence, and justice by ensuring individualized, evidence-based care that respects the child's unique developmental trajectory. Question 6. Assessment of a 7-year-old patient presenting with recurrent ear infections reveals a pattern of missed school days and parental reports of significant stress at home due to the father's recent job loss. The pediatrician notes that the child's mother often appears fatigued and has limited time for follow-up appointments due to her demanding work schedule. The child's school has also reported some behavioral changes in class. Which approach best utilizes Bronfenbrenner's ecological systems theory to inform a comprehensive care plan? Option A. Focus solely on prescribing antibiotics for the ear infections and advising the mother on basic hygiene practices. Option B. Analyze the interplay between the child's family dynamics, microsystem, the communication between home and school, mesosystem, the impact of the father's unemployment and mother's work schedule on family resources and stress, exosystem, and broader societal attitudes towards parental employment and child health, macrosystem. Considering how these factors have evolved over time, chronosystem, to develop a multifaceted intervention plan. Option C. Recommend immediate referral to a child psychologist to address the child's behavioral changes without further exploration of the family's environmental stressors. Option D. Advise the parents to seek new employment for the father and suggest the mother reduce her work hours to improve the home environment. The correct answer is A. Focus solely on prescribing antibiotics for the ear infections and advising the mother on basic hygiene practices. Explanation. This scenario presents a professional challenge due to the interconnectedness of a child's development with their immediate and broader environment, requiring a nuanced understanding beyond just the child's immediate medical needs. The pediatrician must integrate knowledge of Bronfenbrenner's ecological systems theory to provide comprehensive care, recognizing that factors outside the clinic significantly impact a child's health and well-being. Careful judgment is required to identify which environmental factors are most influential and how they can be addressed within the scope of pediatric practice and relevant ethical guidelines. The correct approach involves identifying and analyzing the child's experiences within each of Bronfenbrenner's ecological systems to inform a holistic care plan. This aligns with the ethical imperative to consider the patient's social determinants of health and to advocate for their well-being. Specifically, understanding the microsystem, family interactions, mesosystem, school-parent communication, exosystem, parents' workplace policies affecting family time, and macrosystem, cultural beliefs about health, provides a framework for assessing risks and protective factors. The chronosystem acknowledges the impact of time and historical context on these interactions. This comprehensive assessment allows for targeted interventions and referrals that address the root causes of potential health issues, thereby upholding the principles of beneficence and non-maleficence. An incorrect approach would be to solely focus on the immediate medical symptoms without considering the environmental context. This fails to acknowledge the significant influence of the microsystem and mesosystem on a child's health behaviors and access to care. Another incorrect approach is to overstep professional boundaries by attempting to directly alter aspects of the exosystem or macrosystem without appropriate collaboration or referral. For instance, directly intervening in a parent's workplace or attempting to change societal norms is beyond the pediatrician's direct purview and could lead to ethical breaches related to competence and scope of practice. Furthermore, neglecting the chronosystem by not considering how life transitions or historical events might impact the child's current situation would lead to an incomplete understanding and potentially ineffective care. The professional decision-making process for similar situations should involve a systematic application of Bronfenbrenner's theory. Begin by assessing the child's immediate environment, microsystem, then explore the connections between these environments, mesosystem. Consider indirect influences from larger societal structures, exosystem and macrosystem. And finally, factor in the temporal dimension, chronosystem. This structured approach ensures that all relevant environmental influences are considered, leading to a more accurate diagnosis and a more effective, individualized care plan that respects ethical boundaries and promotes the child's overall well-being. Question 7. Upon reviewing the developmental assessment of a 3-year-old child exhibiting significant delays in expressive language and social interaction, the pediatrician must develop an intervention plan. Which of the following approaches best aligns with the principles of evidence-based pediatric practice and ethical intervention planning? Option A. Implement a plan that immediately enrolls the child in a full-day preschool program, assuming that peer interaction will naturally address the language and social delays without specific therapeutic targets. Option B. Design a plan that relies solely on parental education regarding general child development, without direct therapeutic intervention for the child, and defer any further action until the child's next annual well-child visit. Option C. Develop a plan that prioritizes speech therapy focusing on foundational vocabulary acquisition and social skills training targeting reciprocal interaction, with sessions scheduled twice weekly for an initial period of 3 months, followed by reassessment of progress towards specific, measurable language and social goals. Option D. Create a plan that focuses on a broad range of developmental domains, including fine motor skills and gross motor development, with less emphasis on the primary areas of concern, and schedule services on a flexible, as-needed basis. The correct answer is C. Develop a plan that prioritizes speech therapy focusing on foundational vocabulary acquisition and social skills training targeting reciprocal interaction, with sessions scheduled twice weekly for an initial period of 3 months, followed by reassessment of progress towards specific, measurable language and social goals. Explanation. This scenario is professionally challenging because developing an effective intervention plan requires balancing the child's immediate needs with long-term developmental goals, while also considering family capacity and available resources. The pediatrician must synthesize information from various sources, including the child's medical history, developmental assessments, and family input, to create a plan that is both evidence-based and practical. The absolute priority for the board certified in Pediatrics, BCP, exam is adherence to established pediatric practice guidelines and ethical principles, ensuring patient safety and optimal outcomes. The correct approach involves a comprehensive assessment to inform goal setting, followed by the selection of evidence-based interventions tailored to the child's specific needs and developmental stage. This approach prioritizes individualized care, ensuring that goals are measurable, achievable, relevant, and time-bound smart, and that interventions are appropriate for the child's age and condition. The frequency and duration of services should be determined by the child's progress and the achievement of objectives, with regular reassessment. This aligns with ethical obligations to provide competent and compassionate care, and with BCP standards that emphasize data-driven decision-making and patient-centered planning. An incorrect approach would be to solely focus on the most readily available or least resource-intensive interventions, without a thorough assessment of the child's unique needs and potential impact on their development. This fails to meet the ethical standard of providing individualized care and may lead to suboptimal outcomes. Another incorrect approach would be to set overly ambitious or vague goals that are not measurable, making it impossible to track progress or determine the effectiveness of interventions. This demonstrates a lack of clinical rigor and can lead to wasted resources and patient frustration. Finally, an approach that neglects to involve the family in the planning process or fails to consider their capacity to implement recommendations is ethically flawed and practically unsustainable, as family engagement is crucial for successful intervention. Professional decision-making in such situations requires a systematic process. First, thoroughly gather and analyze all relevant information about the child and family. Second, collaboratively establish clear, measurable goals with the family. Third, select interventions supported by evidence and tailored to the child's needs. And fourth, establish a plan for monitoring progress and adjusting interventions as needed, always prioritizing the child's well-being and developmental trajectory. Question 8. The assessment process reveals a 3-year-old child exhibiting intermittent difficulties with social interaction and a recent increase in temper tantrums. The parents express significant concern about their child's development and behavior. Which of the following represents the most appropriate initial evaluation approach? Option A. Administer a standardized developmental screening tool, conduct a thorough developmental history, and perform direct observation of the child's behavior and interaction during the visit. Option B. Rely solely on the parent's detailed description of the child's behaviors and concerns to formulate a diagnosis. Option C. Focus the evaluation exclusively on the temper tantrums, seeking to identify and address only that specific symptom. Option D. Immediately refer the child for specialized behavioral therapy based on the parent's expressed concerns. Correct answer is A. Administer a standardized developmental screening tool, conduct a thorough developmental history, and perform direct observation of the child's behavior and interaction during the visit. Explanation. This scenario presents a professional challenge due to the need to balance a child's immediate health concerns with the long-term implications of diagnostic and therapeutic decisions, all within the framework of established pediatric best practices and ethical guidelines. The physician must navigate potential parental anxiety, the child's developmental stage, and the evolving nature of pediatric medicine. Careful judgment is required to ensure the evaluation is comprehensive, non-intrusive where possible, and ultimately serves the child's best interests. The correct approach involves a multimodal assessment that integrates direct observation, standardized developmental screening tools, and a detailed history from the caregivers, while also considering the child's current environment and developmental milestones. This aligns with best practice in pediatrics, emphasizing a holistic view of the child's well-being. Regulatory and ethical guidelines for pediatric practice, such as those promoted by the American Academy of Pediatrics (OP) and implicitly by the board certified in Pediatrics BCP certification, advocate for evidence-based, child-centered evaluations that consider the interplay of biological, psychological, and social factors. This approach ensures that potential issues are identified early and addressed appropriately, respecting the child's developmental trajectory and the family's concerns. An approach that solely relies on parental reporting, without objective assessment risks, overlooking subtle developmental delays or behavioral patterns that may not be apparent to caregivers. This fails to meet the standard of a thorough pediatric evaluation, potentially leading to delayed diagnosis and intervention. Another incorrect approach, focusing exclusively on a single symptom without considering the broader developmental context, is insufficient. Pediatric development is complex and interconnected. Isolating one aspect can lead to misdiagnosis or an incomplete understanding of the child's needs. Furthermore, an approach that prioritizes immediate, potentially invasive interventions without a comprehensive initial assessment is ethically questionable. Best practice dictates a stepwise, evidence-based approach that minimizes unnecessary interventions and maximizes diagnostic accuracy. Professionals should employ a systematic decision-making process that begins with a broad understanding of the child's presenting concerns, followed by the selection of appropriate assessment tools and strategies based on age, developmental stage, and clinical presentation. This involves continuous critical evaluation of findings, consultation with colleagues when necessary, and open communication with the family, always prioritizing the child's welfare and adhering to established ethical and professional standards. Question 9. Performance analysis shows that a 4-year-old child presents with some observed behaviors suggestive of sensory processing differences, including a tendency to seek out intense tactile input and a marked aversion to certain auditory stimuli, as noted during a routine developmental screening. The pediatrician has reviewed the initial screening tool results, which indicate potential areas of concern related to sensory modulation. Which of the following represents the most appropriate next step in managing this child's care according to boards certified in Pediatrics BCP guidelines? Option A. Refer the child to an occupational therapist with specialized training in sensory integration for a comprehensive sensory processing evaluation and potential intervention planning. Option B. Immediately implement a behavioral modification program to address the observed aversions and seeking behaviors. Option C. Refer the child to a general developmental pediatrician for a broad reevaluation of developmental milestones. Option D. Advise the parents that these behaviors are common at this age and likely to resolve without intervention. Correct answer is A. Refer the child to an occupational therapist with specialized training in sensory integration for a comprehensive sensory processing evaluation and potential intervention planning. Explanation. This scenario presents a professional challenge because it requires a pediatrician to interpret and act upon sensory processing assessment results in a manner that is both clinically sound and ethically responsible, adhering strictly to the board certified in Pediatrics BCP regulatory framework. The challenge lies in selecting the most appropriate next step when initial assessment data, suggests potential sensory processing difficulties, balancing the need for further investigation with avoiding unnecessary interventions or parental anxiety. Careful judgment is required to ensure that any recommended actions are evidence-based, child-centered, and aligned with established pediatric practice guidelines. The correct approach involves a comprehensive review of the assessment findings in the context of the child's overall developmental history and observed behaviors, followed by a referral to a qualified occupational therapist specializing in sensory integration. This approach is justified by BCP guidelines, which emphasize a holistic and evidence-based approach to pediatric care. Referrals for specialized evaluations are indicated when initial assessment suggests a need for further in-depth investigation by experts in specific domains. An occupational therapist with expertise in sensory integration is uniquely qualified to conduct further, more detailed sensory processing assessments and to develop targeted intervention strategies if warranted. This ensures the child receives appropriate, specialized care. An incorrect approach would be to immediately initiate behavioral interventions based solely on the initial screening results, without further specialized assessment. This fails to adhere to the BCP's emphasis on accurate diagnosis and evidence-based practice. Jumping to interventions without a thorough understanding of the underlying sensory processing patterns could lead to ineffective or even detrimental outcomes for the child. Another incorrect approach would be to dismiss the findings as insignificant and take no further action. This neglects the potential impact of sensory processing differences on a child's development, learning, and social-emotional well-being, and violates the BCP's ethical obligation to advocate for the child's best interests and to pursue appropriate diagnostic pathways when concerns arise. A further incorrect approach would be to refer the child to a general developmental pediatrician for a broad reevaluation, without specifying the need for sensory processing expertise. While a developmental pediatrician is a valuable resource, a referral to an occupational therapist with specific sensory integration training is more direct and efficient for addressing the identified concerns, ensuring the child is seen by the most appropriate specialist without delay. The professional decision-making process for similar situations should involve a systematic evaluation of the presented data, consideration of the child's presenting concerns and developmental trajectory, consultation with relevant BCP guidelines and ethical principles, and a clear rationale for the chosen course of action. This includes identifying the most appropriate specialist for further assessment and intervention when initial findings suggest a need beyond the pediatrician's primary scope of practice. Question 10. Implementation of a new therapeutic intervention for a child with a chronic respiratory condition requires careful monitoring of progress. Which approach best reflects a comprehensive outcomes evaluation strategy for this pediatric patient? Option A. Focusing exclusively on the absence of acute exacerbations and hospitalizations, without assessing underlying lung function or daily functional capacity. Option B. Regularly collecting objective data on lung function tests, correlating these with the child's reported activity levels and parental observations of breathing ease and frequency. Option C. Primarily relying on the parent's subjective reports of the child's overall mood and energy levels, assuming these reflect respiratory improvement. Option D. Measuring the child's weight gain as the sole indicator of successful intervention, as improved nutrition is often linked to better health. The correct answer is B. Regularly collecting objective data on lung function tests, correlating these with the child's reported activity levels and parental observations of breathing ease and frequency. Explanation. This scenario presents a professional challenge because effectively evaluating a child's progress and the impact of an intervention requires a multifaceted approach that goes beyond simple observation. It demands a systematic and evidence-based methodology to ensure the child receives the most beneficial care and that resources are utilized effectively. The pediatrician must navigate the ethical imperative to provide optimal care while adhering to professional standards for outcomes evaluation. The correct approach involves a comprehensive assessment that integrates objective measures with subjective reports, aligned with established pediatric developmental milestones and evidence-based practice guidelines. This approach is ethically justified by the principle of beneficence, ensuring the child's well-being is paramount, and by the principle of non-maleficence, by avoiding ineffective or potentially harmful interventions. Professionally, it aligns with the standards of care expected in pediatric practice, which emphasize data-driven decision-making and continuous quality improvement. Regulatory frameworks in pediatrics often mandate or strongly encourage the systematic evaluation of treatment efficacy to ensure patient safety and optimal outcomes. An incorrect approach that relies solely on parental subjective reports, while important, fails to provide objective data to confirm progress or identify subtle developmental delays. This can lead to a delayed recognition of issues or an overestimation of improvement, potentially violating the duty of care. Another incorrect approach that focuses only on the absence of acute symptoms overlooks the broader developmental and functional outcomes crucial for a child's long-term well-being. This narrow focus can result in a child not reaching their full potential. An approach that prioritizes the child's immediate comfort over a thorough evaluation of intervention effectiveness risks perpetuating suboptimal care and failing to address underlying issues, which is ethically and professionally unsound. The professional decision-making process for similar situations should involve a framework that begins with clearly defining the goals of the intervention. This is followed by selecting appropriate, validated outcome measures that are sensitive to change and relevant to the child's specific condition and developmental stage. Data collection should be systematic and consistent. Finally, the collected data must be analyzed critically to inform ongoing care decisions, adjust interventions as needed, and communicate findings transparently with the child's family. Question 11. Which approach would be most appropriate for a pediatrician when a parent expresses concerns about their child's language development and the pediatrician suspects a potential developmental delay? Option A. Immediately refer the child to a speech-language pathologist without conducting any initial assessment or discussion with the parents about the pediatrician's observations. Option B. Conduct a comprehensive diagnostic assessment for a specific disorder without informing the parents of the full scope of the assessment or its potential implications. Option C. Administer a validated developmental screening tool, discuss initial findings with the parents, and collaboratively decide on the next steps, which may include further specialized assessment or observation. Option D. Reassure the parents that most children catch up on their own, and suggest waiting another 6 months before any further evaluation. The correct answer is C. Administer a validated developmental screening tool, discuss initial findings with the parents, and collaboratively decide on the next steps, which may include further specialized assessment or observation. Explanation. This scenario is professionally challenging because it requires balancing the need for accurate developmental assessment with the ethical imperative of informed consent and parental autonomy. Pediatricians must navigate potential parental anxiety, cultural beliefs, and varying levels of understanding regarding developmental milestones and the implications of assessment findings. Careful judgment is required to ensure that the assessment process is conducted in a way that is both clinically sound and respects the family's rights and values. The correct approach involves a comprehensive, multifaceted assessment that integrates standardized tools with direct observation and parental input, while prioritizing clear communication and shared decision-making. This aligns with the ethical principles of beneficence, acting in the child's best interest, and respect for autonomy, honoring the parent's right to make informed decisions. Regulatory frameworks for pediatric practice emphasize the importance of evidence-based assessment and the need for practitioners to be competent in interpreting and communicating findings. Furthermore, ethical guidelines stress the importance of obtaining informed consent from parents or guardians for any medical intervention or assessment that could lead to significant decisions about a child's care. This approach ensures that the assessment is thorough, accurate, and conducted in a manner that empowers the family. An approach that relies solely on a single standardized screening tool without further investigation or parental input is professionally unacceptable. This fails to capture the full spectrum of a child's development and may lead to misinterpretation or over-reliance on a potentially limited snapshot. It neglects the crucial role of parental observation and can create unnecessary anxiety or false reassurance. Such an approach may also fall short of regulatory requirements for thoroughness in assessment. Another incorrect approach is to proceed with a detailed diagnostic assessment without first obtaining explicit informed consent from the parents regarding the purpose, procedures, and potential implications of the assessment. This violates the principle of autonomy and can erode trust between the pediatrician and the family. It also disregards legal and ethical mandates for informed consent, which are fundamental to patient care. Finally, an approach that dismisses parental concerns as simply anxiety without thorough investigation or validation is professionally unsound. Parental intuition and observation are valuable components of a child's developmental assessment. Ignoring these concerns can lead to misdiagnoses and a failure to address potential developmental delays or challenges effectively, thereby failing the principle of beneficence. Professionals should employ a decision-making framework that begins with understanding the presenting concern, gathering information from multiple sources, including parents and direct observation, selecting appropriate assessment tools based on the child's age and developmental stage, and engaging in open, transparent communication with parents throughout the process. This includes explaining the rationale for assessments, discussing findings clearly, and collaboratively developing a plan of action that respects the family's values and goals. Question 12. The analysis reveals that a 7-year-old child presents with a condition requiring a potentially uncomfortable but necessary medical procedure. The pediatrician needs to explain the procedure to the child and obtain their cooperation. The child has a history of average development, but has recently shown some distractibility in school. The pediatrician must decide how to approach explaining the procedure and seeking the child's agreement, considering the child's cognitive development and executive functions. Option A. Explain the procedure in detail, using complex medical terminology, and expect the child to make a fully informed decision based on the information provided. Option B. Conduct a thorough assessment of the child's attention, memory, and problem-solving skills to gauge their capacity to understand the procedure and its implications. Then tailor the explanation accordingly, seeking assent. Option C. Rely solely on the child's chronological age to determine the appropriate level of explanation and involvement, without further cognitive assessment. Option D. Provide a simplified explanation of the procedure, focusing only on the immediate sensation, and proceed with the assumption that parental consent is sufficient for cooperation. The correct answer is B. Conduct a thorough assessment of the child's attention, memory, and problem-solving skills to gauge their capacity to understand the procedure and its implications. Then tailor the explanation accordingly, seeking assent. Explanation. This scenario is professionally challenging because it requires the pediatrician to balance the immediate need for intervention with the child's developing cognitive abilities and the legal/ethical obligations surrounding parental consent and child welfare. The pediatrician must assess the child's capacity to understand the situation and participate in decision-making, while also respecting parental rights and responsibilities. The core of the challenge lies in accurately gauging the child's executive functions, specifically their problem-solving and decision-making skills, in the context of a potentially distressing medical situation. The correct approach involves a comprehensive assessment of the child's cognitive development and executive functions to determine their capacity for assent. This approach is ethically justified by the principles of beneficence, acting in the child's best interest, and respect for autonomy, which, as the child matures, includes their right to be involved in decisions about their own health care. Legally, in the U.S., while parental consent is paramount, the concept of mature minor doctrine can, in certain circumstances and jurisdictions, allow minors to make their own medical decisions if they demonstrate sufficient understanding and maturity. This approach prioritizes understanding the child's individual capabilities before proceeding with any intervention that requires their cooperation or understanding. An incorrect approach would be to proceed with a complex explanation and expect full comprehension and decision-making from a child who has not demonstrated the necessary cognitive maturity. This fails to respect the child's developmental stage and could lead to anxiety, non-compliance, and a violation of their developing autonomy. Ethically, it oversteps the bounds of what can be reasonably expected from a child's cognitive abilities. Another incorrect approach would be to solely rely on parental consent without any attempt to involve or inform the child, regardless of their apparent cognitive abilities. This neglects the ethical imperative to involve the child in their care to the extent possible, which can foster trust and cooperation. It also fails to acknowledge the evolving rights of the child as they mature. A third incorrect approach would be to make assumptions about the child's understanding based on their age alone, without a specific assessment of their cognitive development and executive functions. Age is a guideline, but individual development varies significantly. This approach risks either underestimating or overestimating the child's capacity, leading to inappropriate communication and decision-making processes. The professional decision-making process for similar situations should involve a systematic evaluation of the child's developmental stage, focusing on their attention, memory, problem-solving, and decision-making abilities. This assessment should inform the level of detail and complexity used in explaining medical information and the extent to which the child can participate in decision-making. Collaboration with parents and potentially child life specialists or psychologists can aid in this assessment. The ultimate goal is to ensure that medical interventions are understood and, where appropriate, assented to by the child, while always respecting parental rights and legal frameworks. Question 13. Quality control measures reveal that a pediatrician has recently completed a Bayley Scales of Infant and Toddler Development, 4th edition, Bayley-Roman 4, assessment for a 2-year-old child presenting with developmental delays. The pediatrician is now tasked with interpreting the results and formulating a plan. Which of the following approaches best reflects a process optimization strategy for utilizing the Bayley-Roman 4 data to inform clinical decision-making and care planning? Option A. Presenting the raw scores from each Bayley-Roman 4 domain to the caregivers without significant interpretation, allowing them to draw their own conclusions about their child's development. Option B. Prioritizing the interpretation of the motor composite score as the primary indicator of the child's developmental status, given the initial referral concern focused on gross motor delays. Option C. Relying primarily on the caregiver's subjective report of the child's daily functioning to guide the interpretation of the Bayley-Roman 4 results, assuming their observations are the most accurate reflection of the child's abilities. Option D. Reviewing the child's overall cognitive, motor, language, social-emotional, and adaptive behavior composite scores, alongside individual subtest scores, and integrating this information with the child's clinical history and caregiver observations to develop a comprehensive developmental profile and targeted intervention recommendations. The correct answer is D. Reviewing the child's overall cognitive, motor, language, social-emotional, and adaptive behavior composite scores, alongside individual subtest scores, and integrating this information with the child's clinical history and caregiver observations to develop a comprehensive developmental profile and targeted intervention recommendations. Explanation. This scenario presents a professional challenge because it requires a pediatrician to interpret and apply complex developmental assessment data within the context of established pediatric practice guidelines and ethical considerations. The pediatrician must ensure that the assessment process and subsequent recommendations are not only technically sound, but also ethically responsible, prioritizing the child's best interests and adhering to professional standards. The challenge lies in balancing the detailed information from the Bayley-Roman 4 with the broader clinical picture and the need for clear, actionable communication with caregivers. The correct approach involves a comprehensive review of all Bayley-Roman 4 subtest scores and composite scores, considering the child's developmental history, clinical observations, and caregiver input. This holistic integration of data is crucial for accurate interpretation and the development of a tailored intervention plan. This approach aligns with the ethical principles of beneficence and non-maleficence, ensuring that interventions are evidence-based and appropriate for the child's specific needs. Furthermore, it adheres to the implicit regulatory expectation of providing competent and thorough pediatric care, which includes accurate developmental assessment and management. An incorrect approach would be to focus solely on a single subtest score without considering the overall profile. This could lead to misinterpretation of the child's strengths and weaknesses, potentially resulting in inappropriate or ineffective interventions. Ethically, this demonstrates a lack of thoroughness and could violate the principle of providing individualized care. Another incorrect approach would be to overemphasize caregiver concerns without objectively integrating them with the standardized assessment findings. While caregiver input is vital, relying solely on it without the objective data from the Bayley-Roman 4 could lead to a biased assessment and recommendations that do not accurately reflect the child's developmental status. This could be seen as a failure to provide evidence-based care. A third incorrect approach would be to present the Bayley-Roman 4 results in a manner that is overly technical or alarming to caregivers, without providing clear explanations and actionable next steps. This could cause undue distress and hinder effective collaboration. Ethically, This fails to uphold the principle of informed consent and shared decision-making, which requires clear and understandable communication. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly administer and score the Bailey-Roman 4 according to standardized protocols. Second, analyze all composite and subtest scores in conjunction with the child's developmental history, clinical presentation, and caregiver reports. Third, synthesize this information to form a comprehensive developmental profile. Fourth, develop a clear, evidence-based intervention plan that addresses identified needs and leverages strengths. Finally, communicate the findings and recommendations to caregivers in an understandable, supportive, and collaborative manner, ensuring they are active participants in their child's care. Question 14. Risk assessment procedures indicate that a 7-month-old infant, who is otherwise healthy and meeting feeding and sleeping milestones, scores below the expected range on the Alberta Infant Motor Scale, AIMS, for gross motor development. The infant demonstrates some hesitancy in weight-bearing on extended arms and has difficulty achieving a stable sitting position without support. What is the most appropriate next step for the clinician? Option A. Immediately diagnose the infant with a significant motor delay and refer to a pediatric physical therapist for intensive intervention. Option B. Focus solely on the numerical AIMS score and initiate a referral for a comprehensive neurological workup to rule out underlying pathology. Option C. Reassure the parents that the infant is likely to catch up on their own and no further action is needed, as infant development is highly variable. Option D. Discuss the AIMS findings with the parents, explaining what the score suggests about the infant's gross motor development, and outline a plan for continued monitoring and potential referral based on ongoing assessment and clinical judgment. The correct answer is D. Discuss the AIMS findings with the parents, explaining what the score suggests about the infant's gross motor development, and outline a plan for continued monitoring and potential referral based on ongoing assessment and clinical judgment. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric practice, interpreting developmental assessments and determining appropriate follow-up. The professional challenge lies in accurately assessing gross motor development using a standardized tool like the Alberta Infant Motor Scale, AIMS, and translating those findings into actionable, evidence-based recommendations that align with best practices and ethical considerations for infant care. Misinterpretation or inappropriate action can lead to delayed intervention for potential developmental delays or unnecessary parental anxiety. Correct approach analysis. The correct approach involves a comprehensive interpretation of the AIMS score in the context of the infant's overall clinical presentation and age. This includes recognizing that AIMS scores are not absolute diagnoses, but rather indicators of developmental progress. The appropriate next step is to discuss the findings with the parents, explain what the AIMS score signifies regarding gross motor development, and outline a plan for continued monitoring and potential referral if indicated by the score in clinical judgment. This aligns with the ethical principle of informed consent and shared decision-making, ensuring parents are active participants in their child's care. Furthermore, adhering to the established guidelines for AIMS interpretation and follow-up protocols ensures evidence-based practice. Incorrect approaches analysis. An approach that immediately labels the infant as having a significant motor delay based solely on a single AIMS score, without considering the infant's age, other developmental domains, or the nuances of the AIMS scoring, is professionally unacceptable. This fails to acknowledge the variability in infant development and the limitations of any single assessment tool. It can lead to premature labeling and unnecessary parental distress. Another incorrect approach would be to dismiss the AIMS findings entirely, assuming the infant is developing normally without further investigation or discussion with parents. This neglects the professional responsibility to utilize standardized assessments to identify potential concerns, and can result in missed opportunities for early intervention, which is critical for optimizing developmental outcomes. Finally, an approach that focuses solely on the numerical score, without considering the qualitative observations made during the assessment or the infant's overall clinical picture, is also flawed. The AIMS is designed to be used in conjunction with clinical judgment, and a purely quantitative interpretation can be misleading. Professional reasoning. Professionals should approach developmental assessments with a framework that prioritizes accurate interpretation, clear communication, and evidence-based action. This involves 1. understanding the purpose and limitations of the assessment tool aims. 2. Integrating the assessment findings with the infant's age, medical history, and overall clinical presentation. 3. Communicating findings transparently and empathetically with parents, explaining the implications and next steps. 4. Developing a collaborative plan that may include continued monitoring, further assessment, or referral to specialists as indicated. This systematic approach ensures that decisions are grounded in evidence, ethical principles, and the best interests of the child. Question 15. Strategic planning requires a pediatrician to select the most appropriate method for assessing the gross motor function of a 5-year-old child diagnosed with cerebral palsy to guide the development of an individualized therapy plan. Which of the following approaches best aligns with current best practice and regulatory expectations for this assessment? Option A. Utilizing a general infant developmental screening questionnaire. Option B. Conducting informal observations of the child's movement during a standard well-child visit. Option C. Relying solely on detailed reports from the child's parents regarding their motor abilities. Option D. Administering the gross motor function measure, GMFM. The correct answer is D. Administering the gross motor function measure, GMFM. Explanation. This scenario presents a common challenge in pediatric practice, accurately assessing and monitoring gross motor function in a child with cerebral palsy to inform individualized care plans. The professional challenge lies in selecting the most appropriate and evidence-based assessment tool that aligns with best practice guidelines for this specific population, ensuring that the chosen method provides reliable and valid data for clinical decision-making and communication with families and other professionals. Careful judgment is required to avoid superficial assessments that may not capture the nuances of the child's abilities and limitations. The correct approach involves utilizing the gross motor function measure, GMFM, as a standardized criterion reference tool specifically designed to evaluate gross motor function in children with cerebral palsy. The GMFM assesses performance across 5 dimensions: lying and rolling, sitting, crawling and kneeling, standing and walking, running and jumping. Its validity and reliability in this population are well established, making it a cornerstone for best practice in assessing gross motor skills. Regulatory frameworks and professional guidelines for pediatric rehabilitation emphasize the use of evidence-based assessment tools to ensure quality of care, facilitate appropriate interventions, and track progress effectively. The GMFM directly addresses the need for a comprehensive evaluation of gross motor function, providing a detailed profile of a child's abilities and areas for improvement, which is crucial for developing individualized therapy goals and communicating progress to families and interdisciplinary teams. An incorrect approach would be to rely solely on informal observation during a routine physical examination. While observation is a component of a comprehensive assessment, it lacks the standardization and systematic evaluation provided by a tool like the GMFM. This can lead to subjective interpretations and an incomplete picture of the child's functional abilities, potentially resulting in misinformed treatment plans. Another incorrect approach would be to use a general developmental screening tool not specifically validated for children with cerebral palsy. Such tools may not capture the specific motor impairments characteristic of cerebral palsy, leading to an inaccurate assessment of gross motor function and potentially overlooking critical areas requiring intervention. Finally, relying exclusively on parental report without objective assessment, while valuable for understanding the child's functional limitations in daily life, is insufficient as a primary method for evaluating gross motor function. Objective measurement is essential for establishing baselines and tracking progress in a standardized manner. The professional decision-making process for similar situations should involve a systematic evaluation of available assessment tools. This includes considering the specific clinical question, the child's age and diagnosis, the psychometric properties of the tool, validity and reliability, and its alignment with current evidence-based practice guidelines and regulatory requirements for pediatric care. Professionals should prioritize tools that are standardized, objective, and specifically designed for the population being assessed, ensuring that the data collected is meaningful and actionable for patient care. Question 16. Process analysis reveals that a pediatrician is evaluating a 5-year-old child presenting with concerns about social interaction difficulties and emerging challenges with executive functioning. the pediatrician needs to select an appropriate assessment tool to gather comprehensive information to guide intervention planning. Which of the following approaches best reflects a systematic and child-centered selection process? Option A. Use a highly specialized assessment designed for older children with diagnosed learning disabilities, as it is known for its thoroughness. Option B. Conduct a thorough review of the child's developmental history and current concerns, then select an age-appropriate, validated assessment tool known for its sensitivity to social, emotional, and executive functioning skills, considering the child's ability to engage with the chosen instrument. Option C. Prioritize assessment tools that can be completed quickly to minimize disruption to the child's day, focusing on observable behaviors. Option D. Select a widely used, comprehensive developmental screening tool that the pediatrician has administered frequently in the past, assuming it will capture the necessary information. Correct answer is D. Select a widely used, comprehensive developmental screening tool that the pediatrician has administered frequently in the past, assuming it will capture the necessary information. Explanation. This scenario presents a professional challenge because selecting an assessment tool for a child requires a nuanced understanding of developmental stages, potential learning differences, and the specific goals of the assessment. A mismatch between the assessment tool and the child's needs can lead to inaccurate data, misdiagnosis, and inappropriate intervention planning, ultimately impacting the child's developmental trajectory and educational outcomes. The pediatrician must balance the need for comprehensive information with the child's comfort and engagement during the assessment process. The correct approach involves a systematic evaluation of the child's presenting concerns, developmental history, and the specific information required to guide clinical decision-making. This includes considering the validity and reliability of various assessment tools for the child's age and suspected condition, as well as the practical aspects of administration, such as the child's attention span and tolerance for testing. The pediatrician must also adhere to ethical guidelines that mandate the use of appropriate and evidence-based assessment methods to ensure the child's best interests are served. This aligns with the principles of beneficence and non-maleficence, ensuring that the assessment process is both helpful and harmless. An incorrect approach would be to select a standardized assessment tool solely based on its widespread availability or the pediatrician's familiarity with it, without considering its suitability for the individual child's specific needs and the assessment's purpose. This could lead to a tool that is too complex, too simplistic, or not sensitive to the particular issues being investigated, resulting in unreliable or misleading results. Another incorrect approach would be to prioritize speed or ease of administration over the accuracy and appropriateness of the assessment, potentially overlooking critical information or misinterpreting the child's performance due to an ill-fitting tool. This disregards the ethical obligation to conduct thorough and accurate assessments. Professional decision-making in such situations requires a framework that begins with a clear definition of the assessment's objectives. This is followed by a review of the child's individual characteristics and history to identify potential barriers or facilitators to assessment. Subsequently, a critical evaluation of available assessment tools, considering their psychometric properties, age appropriateness, and relevance to the clinical question, is undertaken. Finally, the chosen tool is administered in a manner that maximizes the child's comfort and cooperation, with ongoing monitoring for any signs of distress or fatigue that might compromise the assessment's validity. Question 17. Consider a scenario where a pediatrician is evaluating a 6-month-old infant presenting with subtle motor delays and reduced visual tracking. The parents express concern that the infant is not reaching typical developmental milestones. The pediatrician suspects a potential issue related to early brain development. Which of the following approaches best reflects the professional and ethical responsibilities in this situation, considering the foundational processes of neural tube formation, myelination, synaptogenesis, and pruning? Option A. Conduct a thorough developmental assessment, including a detailed neurological examination, and consider age-appropriate investigations to explore potential disruptions in neural tube formation, myelination, synaptogenesis, or pruning, while engaging in open communication with the parents about the assessment process and potential findings. Option B. Focus solely on managing the observed motor delays with physical therapy, without exploring the underlying developmental causes related to early brain formation processes. Option C. Immediately diagnose a specific neurodevelopmental disorder based on the limited symptoms and initiate a treatment plan for that condition without further investigation. Option D. Reassure the parents that subtle delays are common at this age, and advise them to wait and see if the infant catches up naturally, without initiating further diagnostic steps at this time. The correct answer is A. Conduct a thorough developmental assessment, including a detailed neurological examination, and consider age-appropriate investigations to explore potential disruptions in neural tube formation, myelination, synaptogenesis, or pruning, while engaging in open communication with the parents about the assessment process and potential findings. Explanation: this scenario presents a professional challenge because it requires a pediatrician to balance the immediate need for accurate diagnosis and intervention with the long-term implications of a child's developmental trajectory. Understanding the foundational processes of brain development, such as neural tube formation, myelination, synaptogenesis, and pruning, is critical for identifying potential deviations and their impact. The challenge lies in applying this knowledge to a real-world clinical presentation, where subtle signs might indicate significant underlying neurological issues, and in communicating these complex concepts effectively to caregivers. The correct approach involves a comprehensive assessment that integrates the child's presenting symptoms with knowledge of typical and atypical brain development milestones. This approach prioritizes a thorough history, a detailed neurological examination, and consideration of age-appropriate developmental assessments. It recognizes that deviations in neural tube formation, myelination, synaptogenesis, or pruning can manifest in various ways, affecting motor skills, cognitive function, and sensory processing. This approach aligns with the ethical obligation to provide competent and evidence-based care, ensuring that diagnostic and therapeutic decisions are informed by a deep understanding of pediatric neurology and development. The regulatory framework for pediatric practice emphasizes the importance of accurate diagnosis and appropriate management of developmental disorders, requiring practitioners to stay abreast of current knowledge in neurodevelopment. An incorrect approach would be to dismiss the caregiver's concerns as typical developmental variations without a thorough evaluation. This fails to acknowledge the potential for early identification of neurodevelopmental disorders, which can significantly impact long-term outcomes. Ethically, this approach neglects the duty of care and the principle of beneficence. Regulatory failure would occur if this oversight led to delayed diagnosis and intervention, potentially violating standards of care. Another incorrect approach would be to immediately jump to a definitive diagnosis of a specific neurological condition without considering the broad spectrum of developmental processes. This premature conclusion can lead to unnecessary anxiety for the family and potentially inappropriate investigations or treatments. It bypasses the crucial step of differential diagnosis and a systematic evaluation of the underlying developmental mechanisms. This approach is ethically unsound, as it may not serve the child's best interest and could lead to misallocation of resources. A further incorrect approach would be to focus solely on symptomatic treatment without investigating the underlying developmental cause. While symptom management is important, it does not address the root of the problem if it stems from a disruption in neural tube formation, myelination, synaptogenesis, or pruning. This approach is professionally deficient, as it fails to provide comprehensive care and may miss opportunities for early intervention that could improve long-term prognosis. It also risks violating regulatory expectations for thorough diagnostic workups in cases of developmental concern. The professional decision-making process for similar situations should involve a systematic approach. Actively listen to and validate caregiver concerns. Conduct a comprehensive history and physical examination, paying close attention to developmental milestones. Consider age-appropriate screening tools and diagnostic tests to evaluate potential disruptions in neural tube formation, myelination, synaptogenesis, and pruning. Formulate a differential diagnosis. Develop a management plan that addresses both immediate concerns and long-term developmental needs, and communicate findings and recommendations clearly and empathetically to the family, respecting their role in the child's care. Question 18. The risk matrix shows a moderate likelihood of developmental delays impacting fine motor skills and sensory processing in a 5-year-old child, whose parents report general clumsiness and difficulty with buttoning shirts. The pediatrician has conducted a brief physical examination and noted no overt neurological deficits. What is the most appropriate next step to identify if the child may benefit from occupational therapy services? Option A. Initiate a referral to occupational therapy for a comprehensive evaluation. Option B. Administer a generic developmental screening questionnaire and refer based solely on the score. Option C. Advise the parents that the child's reported difficulties are within the normal range for their age and no further action is needed. Option D. Conduct a more detailed developmental assessment focusing on fine motor skills, visual motor integration, and sensory processing, and discuss findings with the parents before considering a referral. The correct answer is A. Initiate a referral to occupational therapy for a comprehensive evaluation. Explanation: this scenario is professionally challenging because it requires the pediatrician to balance the immediate needs of a child presenting with subtle developmental concerns against the established referral pathways and the potential for over-referral. The pediatrician must exercise clinical judgment to identify children who may genuinely benefit from occupational therapy OT services, rather than defaulting to a referral for every child with a minor deviation from typical development. This requires a nuanced understanding of developmental milestones and the scope of OT interventions, as well as adherence to the principles of evidence-based practice and efficient resource utilization within the healthcare system. The correct approach involves a comprehensive assessment of the child's developmental profile, considering the specific concerns raised by the parent and observing the child's functional abilities in relevant domains. This approach is justified by the board certified in Pediatrics, BCP, guidelines which emphasize a thorough, individualized evaluation before initiating a referral. It aligns with the ethical principle of beneficence, ensuring that interventions are provided when there is a clear indication and potential for benefit, and also with the principle of non-maleficence, by avoiding unnecessary interventions that could lead to parental anxiety or financial burden. Furthermore, it respects the professional boundaries and expertise of occupational therapists by referring only those children who present with needs that fall within the scope of OT practice, such as difficulties with fine motor skills, sensory processing, self-care activities, or play skills that impact daily functioning. An incorrect approach would be to immediately refer the child for OT services based solely on the parent's general concern about clumsiness, without further clinical investigation. This fails to meet the BCP standard of a thorough assessment and could lead to an unnecessary referral, diverting resources from children who have more significant or clearly defined needs. It also risks over-medicalizing normal developmental variations. Another incorrect approach would be to dismiss the parent's concerns entirely without a proper evaluation, stating that the child is just being a kid and not exploring the underlying reasons for the perceived clumsiness. This approach neglects the pediatrician's duty to investigate potential developmental issues and could miss an opportunity to identify a child who would significantly benefit from early intervention. It violates the principle of patient advocacy and could lead to delayed diagnosis and treatment. A third incorrect approach would be to rely solely on a standardized screening tool without integrating the findings with the child's clinical presentation and parental report. While screening tools are valuable, they are not diagnostic and should be used as a guide for further assessment, not as a definitive determinant for referral. Over-reliance on a single tool without clinical correlation can lead to both false positives and false negatives, undermining the accuracy of the referral process. The professional decision-making process for similar situations should involve a systematic approach. First, actively listen to and validate parental concerns. Second, conduct a thorough clinical assessment, including observation and targeted questioning related to the reported concerns. Third, utilize age-appropriate developmental screening tools as adjuncts to the clinical assessment. Fourth, consider the child's functional impact in daily activities. And fifth, based on the comprehensive evaluation, determine if the child's needs align with the scope of occupational therapy services, and if a referral is indicated for further specialized assessment and intervention. Question 19. System analysis indicates that a 4-year-old child presents with frequent meltdowns at home and in preschool, particularly in noisy environments or when encountering new textures. The child also exhibits a strong preference for deep pressure and is often seen seeking out rough play. The parents report that the child is generally happy, but becomes overwhelmed and agitated by certain sensory inputs. Which of the following approaches best addresses the child's presentation? Option A. Conduct a comprehensive sensory profile assessment, observing the child's responses to various sensory stimuli and gathering detailed caregiver reports on sensory experiences to inform a tailored intervention strategy. Option B. Recommend a trial of a gluten-free and dairy-free diet, as dietary sensitivities can sometimes manifest as behavioral issues. Option C. Implement a strict behavioral modification plan to address the meltdowns, focusing on consistent consequences for disruptive behavior. Option D. Advise the parents to limit the child's exposure to stimulating environments and to avoid any activities that seem to trigger the meltdowns. Correct answer is C. Implement a strict behavioral modification plan to address the meltdowns, focusing on consistent consequences for disruptive behavior. Explanation. This scenario presents a common challenge for pediatricians, discerning typical developmental variations from potential underlying sensory processing or integration issues that may impact a child's behavior and learning. The professional challenge lies in accurately assessing the child's presentation, considering the developmental context, and differentiating between transient behavioral responses and persistent patterns indicative of a sensory processing disorder. This requires a nuanced understanding of sensory systems and their impact on behavior, moving beyond simple behavioral observation to a more integrated assessment. The correct approach involves a comprehensive evaluation that considers the child's sensory experiences in conjunction with their behavioral responses. This includes gathering detailed history from caregivers regarding the child's reactions to various sensory stimuli, e.g., sounds, textures, lights, movement, observing the child's interactions within their environment, and assessing for patterns of avoidance, seeking, or overspensivity. This approach aligns with the ethical obligation to provide thorough and individualized care, ensuring that diagnostic and intervention strategies are based on a holistic understanding of the child's needs. While specific regulations for the board certified in Pediatrics (BCP) exam are not provided, the underlying ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, necessitate a careful and informed assessment to prevent misdiagnosis or delayed intervention. An incorrect approach would be to solely focus on the overt behavioral manifestations without exploring the underlying sensory contributions. For instance, labeling a child as simply difficult or defiant without investigating potential sensory sensitivities would be a failure to adequately assess the child's needs. This could lead to inappropriate behavioral management strategies that do not address the root cause and may even exacerbate the child's distress. Another incorrect approach would be to immediately recommend extensive, potentially costly, and invasive interventions without a thorough, evidence-based assessment of sensory processing. This would violate the principle of proportionality and could lead to unnecessary burden on the family. The professional decision-making process for similar situations should involve a systematic approach. 1. Gather a detailed developmental and behavioral history, specifically probing sensory experiences. 2. Observe the child's behavior in different contexts, noting their responses to sensory input. 3. Consider differential diagnoses, including typical developmental stages, behavioral disorders, and sensory processing differences. 4. Consult with caregivers to understand their concerns and observations. 5. If indicated, utilize standardized screening tools or refer for specialized occupational therapy or developmental pediatric evaluations for sensory processing. 6. Develop an individualized care plan based on a comprehensive assessment. Question 20. Benchmark analysis indicates that a pediatrician has administered the Sensory Integration and Praxis Test, SIPT, to a 5-year-old child presenting with difficulties in motor planning and participation in age-appropriate play. The pediatrician has the raw SIP scores and the child's developmental history. Which of the following represents the most appropriate next step in managing this child's care? Adhering strictly to the regulatory framework and guidelines for the board certified in Pediatrics (BCP). Option A. Provide a diagnosis of a sensory processing disorder based solely on the SIP scores and initiate a home-based sensory diet program without further consultation. Option B. Interpret the SIP scores in conjunction with the child's developmental history and observed behaviors to identify specific sensory integration and praxis patterns, and then formulate evidence-based recommendations, which may include referral to a pediatric occupational therapist with expertise in sensory integration. Option C. Focus solely on the motor planning subtests of the SIPT as these are the most direct indicators of praxis abilities, and recommend specific gross motor exercises. Option D. Immediately refer the child to a developmental pediatrician for further assessment, assuming the SIPT results alone are insufficient for any clinical decision-making. The correct answer is B. Interpret the SIPT scores in conjunction with the child's developmental history and observed behaviors to identify specific sensory integration and praxis patterns, and then formulate evidence-based recommendations, which may include referral to a pediatric occupational therapist with expertise in sensory integration. Explanation. This scenario is professionally challenging because it requires a pediatrician to interpret complex neurodevelopmental assessment data, specifically related to sensory integration and praxis, and translate these findings into actionable clinical recommendations within the scope of their practice, and in alignment with established pediatric guidelines. The pediatrician must consider the nuances of sensory processing disorders and their impact on a child's development, ensuring that their interpretation and subsequent recommendations are evidence-based and ethically sound, prioritizing the child's well-being and family's understanding. The correct approach involves a comprehensive review of the sensory integration and praxis test, SIPT, results, considering the child's developmental history, observed behaviors, and other clinical findings. This integrated interpretation allows for the identification of specific sensory processing and praxis challenges that may be impacting the child's functional abilities. Based on this thorough analysis, the pediatrician can then formulate appropriate recommendation, which may include referral to specialized therapists, e.g., occupational therapists with expertise in sensory integration, further diagnostic evaluations, or targeted developmental interventions. This approach is justified by the ethical obligation to provide competent and evidence-based care, ensuring that diagnostic tools are used appropriately, and their results are interpreted within a broader clinical context to benefit the child. Adherence to the guidelines of the board certified in Pediatrics, BCP, necessitates a holistic understanding of child development and the appropriate utilization of specialized assessments. An incorrect approach would be to solely rely on the SIPT scores without considering the child's overall clinical presentation or developmental trajectory. This could lead to misinterpretation of the data and potentially inappropriate or unnecessary interventions. Another incorrect approach would be to make definitive diagnoses or treatment plans solely based on SIPT results without consulting with or referring to other qualified professionals, such as developmental pediatricians or occupational therapists specializing in sensory integration. This failure to collaborate and to practice within the full scope of one's expertise is a significant ethical and professional lapse. Furthermore, providing recommendations that are not supported by the SIPT findings or broader clinical evidence would also be an unacceptable approach, potentially leading to ineffective or even harmful interventions. A professional decision-making process for similar situations should involve a systematic approach. First, understanding the purpose and limitations of any assessment tool used. Second, integrating the assessment data with the child's complete clinical picture, including history and observation. Third, consulting with relevant specialists when necessary. And fourth, communicating findings and recommendations clearly and empathetically to the child's family, ensuring shared decision-making and adherence to ethical principles of beneficence and non-maleficence.